What should you do if you have back pain? Or if your leg hurts or your sciatic nerve is hurting? If you have problems with your spine, if you have radiculitis, if there are any inflammatory processes, herniated discs in your back, and it starts to hurt, what should you do? Let's figure it out together right now. My name is Vladimir Miroslavovich Golod. I am a neurologist. A neurologist is actually the doctor who treats, not the nervous system, no. A neurologist is the one who treats the back. So today, we're going to talk about the back. We'll figure out what needs to be done so your back doesn't hurt. So, the back is our spine. The spine is our musculoskeletal system. If it's called the musculoskeletal system, that means it serves two functions, support and movement. And our spine consists of two parts. These are the vertebrae. Vertebrae are bones, vertebral bones that are hard, strong, sturdy, and yet fragile. If your spine falls, or if you have some kind of injury, that injury can cause damage to the vertebral bodies. It sort of collapses, like an empty box, and you'll get a compression fracture. And the spine, which is made up of these hard vertebrae, performs its supporting function. Basically, everything in the human body is hung on the spine. The arms, head, neck, torso, ribs, internal organs, and legs are all suspended from it. Everything attaches to the spine so it can bear the load. It has to be strong. But our spine also bends in all directions. And the spine bends thanks to the intervertebral discs located between the vertebrae. Discs are not bone. Discs are cartilage, just like the cartilage in our nose or ear. Cartilage is soft and flexible. It absorbs shock and allows the spine to bend in all directions. But it's important to remember that our spine is also a container for the spinal cord. Inside the spinal canal, the spinal cord runs through here. It's part of the central nervous system that connects the head to all parts of the body, the arms, the legs, everything. And how does it connect? Look. From the spinal cord, at each segment, a pair of nerve roots branches off, one on the right and one on the left. And the whole problem with the spine lies in these nerve roots. These roots get pinched, these roots get inflamed, and they hurt, causing all the issues we have with our spine. Now, look. I'm about to tell you one of the most important things. This is the reason behind all spinal diseases. Among all the causes that are found and pointed out, none of them fully explain everything that happens to our back. The cause of a diseased spine is not just physical strain, not just aging, not just the destruction of vertebrae due to poor blood supply. The main reason for all spinal diseases is that people sleep on their side. This is what the spine looks like in a person who sleeps on their side. The thing is, our spine is perfectly capable of withstanding axial loads from top to bottom, and it can handle them thanks to all these various curves in our back. But our spine does a poor job of handling lateral loads, side bending. And when a person sleeps on a soft bed, sleeps on an orthopedic mattress. I want to point out that orthopedic mattresses are specifically made for people who have back problems. That's right, back problems. On an orthopedic mattress, there is always a bad back. That's an absolute requirement. So, when a person sleeps on their side, the following happens. On one side, the disc starts to get compressed, and then a piece of the disc bulges out. That part of the disc that bulges out is called an intervertebral extrusion. Well, an extrusion can be small in that case. It's called a protrusion, or it can be a large extrusion when the disc comes out, which is called an intervertebral, though the correct term is intervertebral, hernia. So, herniated discs occur because a person has one, what we call a bad habit, sleeping on their side or on their stomach. Both are equally bad. A person should sleep on their back all night. That's what the back is for. The very word spina, back, teaches us that a person should sleep on their back. And so it turns out that during some activities during the day, when a person is standing, sitting, putting strain on the spine, their spine is constantly bending, compressing, the thoracic kyphosis increases, and the lumbar lordosis increases. But after that, a person lies down to sleep on their back, and during the night their back straightens out. It straightens at night, bends during the day, and that's how a person's back stays healthy. Moreover, during the night, the curve of the lumbar spine decreases, the curve of the thoracic spine, the so-called hump, also decreases, and the back remains healthy. But if a person spends the night sleeping on their side, first of all, their back doesn't get any relief from the strain it accumulated during the day, and secondly, this creates the conditions for the formation of an intervertebral hernia, which later becomes a problem for the nervous system. Take a look. You see, in the spot where a person develops an intervertebral hernia, there was a nerve root, and accordingly, from that nerve root starts a nerve that goes in its own direction. For example, from this L5 nerve root, the sciatic nerve begins. And a herniated disc at L5S1 causes compression of the nerve root, which leads to pain in the sciatic nerve. For example, here is the L3-L4 root. If the L3-L4 disc herniations, as you can see here, pinch these roots, then a person starts to have severe knee pain. Essentially, knee pain always comes from compression in the spine. People try to treat the knee, sometimes even operate on it or replace it, when the knee is actually relatively healthy, but it hurts because of pinched nerve roots caused by lumbar intervertebral hernias. Or these two roots, L1 and L2. Compression of these nerve roots by hernias leads to pain in the hip joint. And when a person has hip joint pain, they are often mistakenly diagnosed with coxarthrosis, which either isn't there at all or is present at a minimal level. As a result, the person undergoes joint surgery, has the joint removed, or receives treatment for the hip joint in cases where the problem isn't actually in the joint, the problem is in the spine. The same thing, by the way, applies to the cervicothoracic region. In the cervicothoracic region, even small hernias here in the cervical spine can cause problems with the arms. The arm hurts, the neck and arm hurt, or the neck and head hurt. This happens because of compression in the thoracic section of the spine. So, back problems, compression of nerve pathways and nerve roots in the back, cause pain in the head, arms, legs, and throughout the torso. That's how spinal problems arise. But how should they be solved? Watch this. Initially, the problem starts in the back, and it should also be addressed at the level of the back. Our back is compressed, our back is curved. And to make your back healthy, you need to straighten it, you need to stretch it. Let me say right away, medications used in treating the back can only play a preparatory role. For example, they can relieve pain syndrome, muscle tonic syndrome, or other symptoms. But it's impossible to make the back straight with medication alone. It's impossible to stretch the back with medication. And stretching is an essential condition for restoring the orthopedic integrity of the spine. So, you need to stretch your back. So what? Should you pull by the arms and legs? But it's impossible to stretch the back that way, because a person's legs, as you can see, are attached to the pelvis, not directly to the spine. They will be pulled at a right angle, so the traction will be minimal and weak. And pulling by the arms is completely ineffective, because a person's arms are not attached to the spine, but to the ribs. Check it out for yourself. See how the force is transferred from the arm bones. From the shoulder it goes to the shoulder blade, then to the collarbone, to the sternum, and then to the ribs. But we don't have a direct connection between the arms and the spine, and when a person hangs from a bar, their spine is hanging somewhere off to the side, the force is transferred through the ribs. That's why, to stretch the spine, you need to make sure to start and finish the stretching directly on the spine itself. Notice that our back has a front part of the spine, which is smooth. Thanks to this, we can easily bend forward, but we can't fully arch backward because there are these kinds of spikes at the back of the spine. These are called spinous processes. But the thing is, when our back arches backward, as you can see now, when we bend backward, the spinous processes overlap each other. And look, at this moment the vertebrae separate, and a gap appears here between the vertebrae. This gap appears on the plastic model, on the toy. But as the saying goes, a sacred place is never empty. And so, if a person has a herniated disc, arching backward leads to stretching of the spine. And as a result, the hernia is reduced, returning to the place from which it protruded. So, in order for herniated discs to disappear and return to their place, you need to stretch the spine by arching it backward in a curve. There is special traction equipment, massage beds, that provide this kind of stretching. These devices have rollers that move under a person's back from the nape of the neck to the tailbone. At each point, they arch the back, and by arching it, they stretch it. And after undergoing such stretching on traction equipment, people get up after this kind of massage and their backs become about 1 centimeter to 1.5 centimeters longer. In other words, they become taller. Because the spine has been stretched, herniated discs retract and return to their original place, where they came out from, and the person becomes taller. Pinched nerve roots are released, and over time, as the damaged nerve root heals, all those pains go away. So, in order for a person not to have pain or various neurological disorders, it is necessary to stretch the spine, specifically to do spinal stretching every day, whenever a person is upright or doing any kind of physical activity, and to stretch every morning. Because the main problem with the spine is spending the night in the wrong position. I'm a neurologist, and I very often hear people complain that their back started hurting in the morning. I ask them, why does your back hurt? People say their back hurts because they do a lot of hard work, they carry heavy loads. But the pain started in the morning. So, did you really spend the whole night carrying heavy things? No. Then what happened? What happened is that the person slept in the wrong position at night. So, the first thing you need for a healthy back is spinal stretching. Stretching in the evening after a day spent upright, and stretching in the morning after a night spent with your spine in a wrong, twisted position. But another extremely important factor for a healthy back is choosing the right bed. I teach people that you need to sleep on your back. And I always hear in response that a person can't sleep on their back. They can't fall asleep. They can't manage to sleep that way. And sometimes, even if they do fall asleep, during the night they turn onto their side and still end up twisting their back. So, friends, remember this, no one can sleep on their back as long as the bed allows them to turn onto their side. That's why, in order for a person to be able to sleep on their back, the first thing you need is an orthopedically correct bed. And that's not an orthopedic mattress. On the contrary, an orthopedically correct bed for your back is actually a board that's as firm as possible. You need to take a door off its hinges and put it where you sleep. Back in the day, in medicine, we used to call this sleeping on a shield. In other words, the bed should be as firm as possible, or you can sleep on the floor, because the floor is also firm. And when a person lies down on a hard bed and without a pillow, get rid of your pillow, get rid of any pillow at all. The higher the pillow, the shorter your life. And when a person sleeps on a hard bed without a pillow, they can only sleep on their back. They can't sleep on their side, they can't sleep on their stomach, and they won't be able to turn onto their side once they've fallen asleep. And that's why, in order to keep your back healthy, you need to change your bed. Throw out the bed you have, throw out your expensive orthopedic mattress. Instead, put down a simple, regular board. But to make it less difficult to sleep on this board, you need to make it warm. And that's where Termanium ceramic products come to the rescue. In this case, a Termanium belt or a Termanium mat. They are specially made so that a person can sleep on them all night. You lie down on the Termanium mat on a hard bed that you've prepared in advance, turn on a low temperature, 35 to 38 degrees, no higher is needed, or you can even leave it turned off. Let it work thanks to the magnetic field of the Termanium ceramic. And you leave the Termanium mat under your back for the whole night. Then this warmth, the Termanium mat itself, as well as the magnetic field present in the Termanium ceramic, lead to an acceleration of metabolism and the restoration of the cartilage part of the intervertebral discs. And in addition, the magnetic field has a slight neurocalming effect, which will make it easier for a person on the Termanium mat, on the Termanium ceramic, to fall asleep. And they will be able to sleep on a hard surface, sleep on the Termanium ceramic, and sleep on their back, which will help make their back healthy. So, let's sum up. What does a person need to have a healthy back, and to avoid back pain, leg pain, arm pain, headaches, and other pains related to the spine? Two things are needed for this. The first thing, a person needs to stretch their spine at least twice a day, in the evening before going to bed and in the morning after waking up. There are special devices for this, special massage beds that provide this traction, the spinal traction. Second, you need to sleep on the right kind of bed. It must be a firm bed. Sleep on a Termanium mat so that your spine can recover while you sleep, and only sleep on your back. You know, when people often tell me they have a firm bed, the real test is that on a firm bed, a person simply can't sleep on their side. It's just not possible. And if someone can sleep on their side on their bed, then that bed is considered soft. But you absolutely need a firm bed. A firm bed, a Termanium mat. A person starts sleeping only on their back, and this ensures the health of their spine.